Okay. And I know we have a foot here. Could you want to maybe talk? This could be an ulcer here. Is that why it's red?
Right, that could be a site for an ulcer.
Okay.
Ulcers usually in the feet are anywhere where there's a bony prominence. So this is the first metatarsal region. An ulcer could be there. It could be anywhere along the bottom of the foot. It could be at the side of the foot. This is the fifth metatarsal area. It could be on the toes, on top of the toes if a person has hammer toes, or it could be at the distal end of the toes if these hammer toes are constantly hitting the ground. Actually, I saw a gentleman today who had a condition like that. He had an ulcer at the top of his toe, but it had healed, thank God. Or an ulcer could be at the heel. If a person has surgery, they may not be a diabetic, but if they have surgery and they're laying in a bed, in a hospital bed, for an extended period of time for recovery, they call those pressure sores because they develop because the person is laying in one position over a period of time, and that pressure of the foot against the hospital bed mattress will cause the skin to break down.
Because there's no circulation.
There's no circulation, they're not moving around, and unfortunately the mattresses that they're making these hospital beds from are very detrimental to people. Time and time again, I go see a patient, they were fine when they were at home, they go to the hospital or rehab center, they're not being turned, and they come back home with an ulcer on their heel.
But why are they left like that?
I don't understand it. Well, let me put it this way. Unfortunately, in care right now, we have to do a lot of paperwork. And because of the amount of paperwork that is necessary, there's not as much time for patient care as there should be.
Okay.
So if you have a loved one that's in the hospital for any period of time, make sure you spend time with that loved one. Make sure you ask how often they've been turned, especially if they're bedridden and they can't fend for themselves, if they've had a stroke and they can't speak for themselves, what have you.
That would be horrible to be like that.
But it happens all the time.
Does it really?
Day in and day out,
Oh.
yes. I see this condition all the time.
And you go visit homes and stuff like that.
Yes,
That's
I
where
do.
your doctor care is there.
Yes.
Okay, suppose someone got a big thing right here, you know, like a callus, and underneath of it, it was infected. But they didn't know. Can you have it cut off or remove? What do you do?
You go see your podiatrist.
Okay, but after that, he knows what to do.
He knows what to do. He
Okay.
he will take care of it. We call it debridement, where you take off the dead skin.
Okay.
And then a local wound care is then implemented. And depending on what kind of wound it is, what the circulation is like in the foot, what the nerve sensation is like in the foot, the podiatrist will put the patient on a regimen to heal that wound. If the wound does not heal after a certain period of time, then surgery may be involved to remove the underlying bone that's actually causing the wound not to heal.
Okay. All right, now one more question. What happens when your foot gets so bad they start taking away your toes? Because I had a friend who lost her little toe and then her next toe. And
What's happening there is you just have poor circulation. And in diabetes, it affects your microvasculature. Initially, it was felt to, and the microvasculature just means small vessels.
blood vessels.
Small blood vessels.
Okay.
Our body is a wonderful thing in that
It's a scary thing too.
Sometimes when the small blood vessels become occluded or stopped up because of plaque
Okay.
that has broken away from the larger blood vessels, our bodies can sometimes revascularize. Sometimes new vessels form.
Regenerates.
Exactly.
Okay.
Sometimes new vessels form, not where
Okay.
the old ones are, but new vessels form. So the foot will still feel warm. If the foot feels cold, if you notice that you used to have hair on your toes and you no longer have hair on your toes, if your toenails are getting thicker when they didn't used to be as thick as they were.
What about people who get green toenails? Is that a fungus or?
That's a fungus. That's a
Okay,
type of
that's not a
fungus.
sign of having diabetes.
Not necessarily.
Okay. Now, when we first, the pancreas is the one that shuts down.
Yes.
True. I'm not a doctor like you are, but the pancreas shuts down, and that causes the diabetes because the pancreas can't carry off the stuff that you're eating.
The insulin is no longer being produced, or we become resistant to insulin.
Okay.
People who have large stomachs are considered insulin resistant. They may not be diabetic at that time, but they are insulin resistant and they are headed towards diabetes.
Okay.
So if a person has a tendency to accumulate fat around their stomach, they need to be very careful and go to their physician at least once a year and make sure they're not diabetic, because they are
Okay.
definitely pre-diabetic.
Okay, like we were talking before I went on the air, my sister has a son who was drinking 25 and 30 beers a day. And like you said, I never noticed it. I couldn't tell when they came over for family functions. But now he has diabetes type 2. And, you know, he says, how did I get it? I said, you gave it to yourself. He says, no, you're supposed to be, it's hereditary. I said, type 1. I said, this show is going, I'm giving them the show today. And he said, no, he doesn't think he gave it to himself because he drank beer. But will you please tell him, Michael, you got it for drinking, right?
Absolutely. I was saying before we went on the air that I had this patient several years ago that was a truck driver. He was in his early 40s. And he had a wound that was not healing. I would go see him every 2 weeks and it just wasn't healing. I thought it was a wart because his previous podiatrist had diagnosed it as a wart.
It was on his foot?
It was on his foot. It was on
Okay.
his big toe. And one time I went over to see him one Sunday morning and he had a fever and his toe was still not healed. I sent him to the hospital. He ended up having an amputation on that toe.
Oh my God.
Because he was sedentary.
The big toe.
He was sedentary, he was drinking a lot, and he developed diabetes.
But if you lose your big toe, that's your strong toe to help support your foot, isn't it? The big toe?
It helps you in ambulation,
Yeah.
yes, but
So,
what
when
we
you
do,
lose it,
what we do when a person loses any part of their foot,
Ah.
they get a special device called, well, an
like a
orthotic.
prosthesis?
Yeah, an
Okay.
prosthesis, and it fills in that area of the foot that
Empty space.
may be missing.
Yeah, because I would think your walk would be certainly off balance if you lost that big toe.
Well, some people lose their toes, some people
Ah.
lose all of their toes, and some people lose half of their foot.
And some people, I guess, could lose their whole foot.
Exactly.
All because we're
All
too damn
right.
stupid to look out for our own selves. We've got to watch what we put into our mouths.
There was a patient I had several years ago as well. When I saw her, she was already in amputation. She was already an amputee. She was still smoking. Her foot was beet red.
Drinking too?
Very cold. No, she was not. I don't believe she was drinking alcohol, but she was still smoking. And she did not believe that smoking had anything to do with her poor circulation or the fact that she was an amputee. And the next time I saw her, she was in the hospital.
Nicotine restricts your blood vessels to flow.
Exactly.
I'm not a doctor, and I know that much.
That's right.
This has been very interesting, this whole show. Our time is almost up. Can you believe that?
Really?
Yeah. I mean, this is something I wanted to do for so long. I may have you come back for another one because I want to get the word out to the children. And I want to make sure mom and dad sits around that television set and has the child sit around and say, look, this could be your foot one day.
That's right.
And I'm going to give a copy of this tape to Michael, too, because I think he's a handsome young man, hardworking, but he liked his beer too much, so it's time for him to put down the beer.
That's right.
And if he wants to live and be happy and healthy.
That's
But
right.
number two, you give it to yourself by the way you eat and drink and
That's
the way
right.
you live. And number one, you're born with is a heredity.
Yes, that's right.
Well, it's time for me to... Yeah, he's putting up the sign. It's time for me to get off of here. But, you know, I've enjoyed having you so much.
Well, thank you.
I stayed awake till 3 o'clock this morning thinking about this show, every show I do is important to me. It's just like the first one. And children are important to me, and so are men and women. So I want to thank you, Dr. Andre, for being here with me today. And I want to thank each and every one of you for listening. And please, please, please listen to what we've just said. Thanks for watching. Until next time.